Friends and colleagues, I'm very sad that I cannot be with you in Canada, particularly in this very special year, 2016, celebrating 30 years of the Ottawa Charter. When we developed the Charter 30 years ago in Canada, one of the important features was that it was a coalition. It was a coalition between representatives of government and civil society. And as many of you know, the Canadian Public Health Association played a very, very critical role in moving the agenda forward. But we also had many other civil society representatives there. One of my favorites, obviously, was the Women's Health Collective from Boston that had pushed the empowerment of women. So 30 years later, we are in a very special situation. Health promotion has grown in many countries, but perhaps not grown in the way that many health promotion advocates thought it would grow. My view is that the health promotion thinking has been very, very successful, but health promotion infrastructures and health promotion financing have perhaps not been that successful. If you look at the 5 action areas of the Ottawa Charter, it's very clear the way we do prevention today is health promotion, and the obesity agenda is a typical example. We no longer talk just of the behavior of people. We talk about obesogenic environments, we talk about healthy public policies, and we talk about people's empowerment. So I believe we're at a fantastic point in time where we can move health promotion forward, where we can make it part not only of the NCD agenda, but of course also part of the infectious disease agenda, in fact of any health agenda, because health is built on empowerment, strong policies, and supportive environments. One of the great opportunities for health promotion now in 2016 is the adoption of the Sustainable Development Goals last year. The Sustainable Development Goals stand for a transformative agenda, and of course that's what health promotion has been from the very start, a transformative agenda. Remember the subtitle of the Ottawa Charter, the move towards a new public health. And it's this move and this constant movement that health promotion has to be involved in and has to take forward. The SDGs expect that there is intersectoral policies. No SDG stands on its own. They all interface. And there is practically no area of public health or global health that has more experience in intersectoral action and in bringing many different actors, civil society in particular, into moving the health agenda forward. Therefore, I think health promotion can clearly play a leadership role in the implementation of the SDGs, because it can bring that experience to the table, it can bring that creativity to the table, and it can show 30 years of experience how it can be done. Health promotion has a fantastic opportunity this year because China, together with WHO, is hosting the Shanghai Health Promotion Conference. So in a way, it's a big birthday celebration for health promotion, but at the same time, of course, has the challenge to truly take the agenda forward. It has given the focus on the one hand to the Sustainable Development Goals, but on the other hand to look particularly at the local level, taking into account that the majority of the world is now urbanized and that many of the health promotion challenges take place at the local level, at city level, and that many global health agendas have actually been picked up by mayors and by city governments to move them forward. Health promotion can move forward in Shanghai also because it's very symbolic that the largest country in the world and one of the emerging economies, as we say, is taking health promotion seriously and is taking issues such as health literacy that we have promoted in health promotion from the very start very, very seriously, both nationally and internationally. So we can see that Shanghai will be able to move us forward with a truly global health promotion agenda, with an agenda where the developing countries and the emerging economies contribute significantly to the outcomes of the conference, and where the focus is not only on national governments, but also on other governance levels, action at the local level, as I've said, action at the global level, and at the regional level. So with the recommendations from Shanghai, I hope that health promotion will be able to move forward into its next 30 years. Who knows where that conference will be, and that many of the younger people who might be at Shanghai can take the issue forward now. Health promotion is a challenge now to a new generation. For us who were there in Ottawa, Shanghai is a wonderful opportunity to once more let our voice be heard. But Shanghai must also be the conference where we hand over to a new generation of health promotion leaders, and I wish them a lot of luck. I thank you very much for this opportunity to speak to you virtually. As I said before, I wish I could be with you at the conference. I wish you exciting discussions. I wish that you come up with very interesting and important recommendations for Shanghai that can be discussed both in the lead up to Shanghai and at the conference itself. And I hope you will be satisfied with the outcomes of your conference, and I hope to see some of you in Shanghai in a couple of months' time. Thank you very much.